Okay, picture this. It's exactly like something you'd see on TV. The call comes into the ER. A young guy, just in his 20s, is on his way in. He's confused, totally out of it, and his skin, it's got this weird yellow color. His body is screaming for help, and you know the clock has already started ticking. So let's scrub in and see if we can figure out what's going on here. So our patient, he's only 22. A kid, really. He works as a porter, he's fit, no big health issues to speak of. Well, except for a recent case of tuberculosis that he was getting treatment for. The fact that he's so young just makes this whole situation way more shocking, way more urgent. And get this, it wasn't family or friends who found him. It was his landlord. The landlord noticed he was suddenly just really confused. This is not some simple bug. Something has hit his brain and hit it fast. He can't think straight. He's completely disoriented. I mean, can you imagine? That's terrifying for anyone, but for a healthy 22-year-old, it's just unbelievable. The ER docs, they quickly pinpoint ground zero for this whole crisis. It's his liver. The body's main processing plant, well, it's shutting down. And here's the thing, when the liver goes, everything starts to go. So the big mystery we've got to solve here is why? Why is this happening? All right, so let's step into the ER with the medical team. They're starting their initial workup, and this is where we're going to find our first clues to this whole puzzle. Okay, so these initial findings are the first puzzle pieces on the board. He's confused, and his Glasgow coma score is 13. A perfect score is 15, so that tells us right away his brain is not okay. Then you have the jaundice, that yellow skin. That's the textbook sign that the liver isn't filtering out waste products. And then there's this thing called asterixis. It's a very specific kind of hand-flapping tremor. This isn't just some random twitch. It's a huge red flag that toxins are building up in his blood and messing with his brain, all because the liver isn't doing its job anymore. So the physical exam definitely sets off alarm bells, right? But it's the blood work, the labs. That's where the true scale of this catastrophe becomes clear. Let's look at the numbers, because they tell the real story of what's happening inside his body. First up, bilirubin. So a normal level, it should be under 21. His is 357. That is just off the charts. It's a huge buildup of this yellow waste product that the liver is supposed to get rid of. This number is exactly why his skin is yellow. His body is just swimming in a toxin it has no way to clear. Next, we've got ALT. You can think of this one as an SOS signal coming directly from his liver cells. Normal is somewhere under 50. His, over 1,300. That number is just screaming that his liver cells are dying, and they're dying in huge numbers. The organ is under a massive direct assault. And this might be the most terrifying number of all. Prothrombin time. Basically, it's how long it takes for your blood to clot. Normal is about, 11 to 13 seconds. His is almost 54 seconds. Let that sink in. His liver is so fried it can't make the proteins needed for clotting anymore. This is a full-blown 5-alarm fire. It means one of the liver's most critical jobs has just stopped. Okay, so the patient is in critical condition. The investigation has to start, right now. The doctors, they basically turn into detectives. They have to draw up a list of all the possible culprits. In medicine, they call this a differential diagnosis. So here's the lineup of usual suspects. Could it be a drug? I mean, his TB meds are definitely a possibility. Or what about a virus? Something like hepatitis A or B? Maybe his own immune system has gone rogue and is attacking his liver. You even have to consider the rarest stuff, like Wilson's disease or even cancer. At this stage, everything has to be on the table. You can't rule anything out. All right, so the team has their list of suspects. Now it's time to move to targeted testing. They've got to interrogate the evidence, run the tests, and start narrowing down this search. And this is a perfect example of how methodical doctors have to be. There's a process, a protocol they follow. They ask a specific set of questions and run a specific set of tests, all designed to take them from that huge list of possibilities down to the one single thing they can actually treat. So this is the detective's toolkit for this kind of case. It's called the liver screen. Every single test on this list is designed to either rule a suspect in or rule them out. They check for paracetamol because that's a really common one. They look for hepatitis viruses. They hunt for markers of an autoimmune attack. They even screen for that rare genetic thing, Wilson's disease. It is pure, methodical, evidence-based detective work. And then the test results start coming back. The picture gets clearer and clearer until finally they have it, the diagnosis. And just like that, the mission shifts from what is it to how do we fight it? The battle for this young man's life is on. So, what's the official diagnosis? It's acute liver failure, or ALF. And our patient, well, he ticks every single box. 1, rapid liver dysfunction. We see that with the jaundice and the clotting problem. 2, encephalopathy. That's just the fancy medical term for his brain not working right, causing all the confusion. And 3, and this is key, no previous history of liver problems. This came out of nowhere. It is a sudden, full-blown crisis. And the culprit is a toxic reaction to isoniazid. That's one of the main drugs he was taking for his tuberculosis. Think about that for a second. The very medicine that was supposed to be curing him of one disease has now kicked off another one that could kill him. It's a really cruel twist. Okay, they have the diagnosis. There is zero time to waste. The battle plan is immediate and aggressive. They're pumping him full of IV fluids. They're checking his blood sugar every hour because his failing liver can't control it. He's on antibiotics to ward off infections because his system is so weak. They're giving him N-acetylcysteine, a drug that can sometimes shield the liver from more damage. And of course, he's in the ICU, and the liver transplant team has been put on notice. This is absolutely all hands on deck. And if you want to know just how serious this is, get this. Based on the official criteria, this patient qualified for a liver transplant the second he arrived at the hospital. His clotting time was over 50 seconds, his bilirubin was through the roof, and the cause was a drug reaction. The ultimate backup plan, a transplant, was already being considered from minute 1. So while the team is managing this immediate crisis, let's take a step back for a minute. We need to ask the big question here. What can we learn from this? How do we stop this from happening to someone else? You know, this is the kind of question that really sticks with doctors after a case like this one. A young guy's life is hanging in the balance, all because of a known side effect from a pretty common drug. So really, how could this have been prevented? Well, our source material actually lays out a pretty clear roadmap. First, patient education. You've got to make sure people know the risks. Second, check their liver function with a simple blood test before they even start the medication. Third, you keep an eye on those tests, and if the numbers start to go up, you act. And finally, you tell patients, hey, if you start feeling sick in any way, nauseous, tired, anything, you need to see a doctor right away. Those can be the very first warning signs. So when you boil it all down, all the tests, the ICU, the transplant team on standby, all of it, what's the one thing? What is the single most powerful tool that could have completely changed how this story played out? Patient education. It's that simple and it's that profound. If this young man had just known, if someone had told him, listen, this medication could hurt your liver. If you feel sick at all, for any reason, stop taking it and call your doctor immediately. If he had known that, this whole nightmare might have been avoided. It's just a huge reminder that in our world of high-tech medicine, sometimes the most powerful, life-saving thing you can do is just have a conversation.